EOMI, extraocular movement intact. The patient's eye damage was not serious, so the nurse wrote EOMI in the file. CAD, coronary artery disease. He had a massive heart attack because he had CAD. PND, proximal nocturnal dyspnea. She has an acute dyspnea caused by lung congestion and heart failure, occurring suddenly at night, called PND. MRI, magnetic resonance imaging. The doctor asked for an MRI so he could get a better look at the patient's head injury. TSH, thyroid stimulating hormone. Only a TSH test could make sure a patient has no thyroid problems. Bradycardia, slow heart rate. Her heart was experiencing bradycardia after she took too many of her Xanax. Trichomoniasis, infection of the genital and urinary tract. It's an STD. She was diagnosed with trichomoniasis and was given antibiotics. Pyrogenic, produced by a fever. The patient began to have seizures that were pyrogenic. Syndactylism, fingers or toes that are fused together. The baby was born with syndactylism, so the doctor did surgery to separate her fingers. Cholangiogram. The patient was having pain in the upper right quadrant of her abdomen, so the doctor ordered a cholangiogram to check her bile ducts. Transillumination, passage of a strong light through a body structure to permit inspection from the other side. The doctors performed a transillumination to get a better look at the organ. Mammography, process of taking a breast x-ray. The patient is having mammography to check for breast cancer. Catheterization, inserting a tube into the bladder. During surgeries, patients need to have catheterization to help with urination. Heterogeneous, different throughout. The mammogram result showed the breasts were heterogeneous. Septicemia, infection in the blood. He didn't take his entire antibiotic for the infection, so he got septicemia. Aberrant, go from normal location process of behavior. The nerves in her spine began to aberrant outside. Poliomyelitis, inflammation of the gray matter of the spinal cord. The child was not vaccinated, so she was diagnosed with poliomyelitis. Osteoporosis, deterioration of the bone. Since the woman did not take her calcium, she was diagnosed with osteoporosis. Hydrocephalus, fluid in the skull causing deformities and brain damage. The newborn was born with hydrocephalus, so the doctors are going to place a shunt to drain it. Amniocentesis, surgical puncture of the abdomen to remove fluid. The doctor did an amniocentesis to get amniotic fluid to see if the fetus's lungs were developed.